So we have Gigi with us, who's the most happening gynecologist in town. If you could change one thing about how we educate our girls about their body in our society, what would it be?
So these days what I come across in my OP are more the younger girls especially regarding the liberal usage of the emergency contraception. That's like IPL, the most commonly called. So it's been very liberally used. Every other day I have, young unmarried girls also coming and saying that, the pregnancy is turned positive. We don't know how. We have used contraception still. So I keep asking them, what contraception do you? It's like, we have used IPL. Like IPL is they don't even understand the fact that IPL is a emergency contraception, a heavy dose hormonal pill, which is used as an emergency contraception only in case of dire situations where there is some situation of rape or unexpected unprotected intercourse happened once in a while and you don't have any other option left, then you take it.
It is not something
it's not a contraception. It's not a contraception. It's an emergency contraception. There's a lot of difference between a contraception and an emergency contraception. Contraception is where you prevent the pregnancy. You actually use a proper method of contraception. Only this is emergency contraception, unprotected intercourse in some situation, then only you take it. So there is a vast difference between them. But then it generally is considered as a contraceptive method, and that's what, especially the younger girls these days when they come to my opinion.
I think that's also because the whole, discussion between a parent and a child regarding when they become, menstrually active or regarding sexual health, and there is still a lot of taboo.
Yes. This is not something which we can sit across the dining table and talk in the, in our home. That's still considered. It should be. It's just like anything else. It has to be discussed and talked. That's how the sex education is about. Sex education is not about talking about sex. It's the general perception is about sex education is that talking about. No, it's not that. It's about so many other things, like right from the good touch, the bad touch to understanding the body, teaching your body how the normal physiology, the anatomy of your body, how this whole thing works, and what all can be done,
instead
in
of
different
blaming
situations.
them after something happened, preparing them to prevent
the situations about everything. That is all about, which is never, discussed. Even now, vast majority, I don't think there is very, very few homes where you can actually sit, the parents can sit and tell their, daughter, even the fathers, they don't even talk about, even right from the periods also, they don't talk about it. So that's how the whole our society has been. So I think the younger girls, they needs to be more educated about the liberal use of the contraceptive pills.
Another thing that I feel is not at all spoken about are reproductive health and vaccinations related to it. I feel it's absurd that nobody talks about it, and it's until recently that even people started talking about rubella vaccinations or HPV vaccinations, and how you're supposed to take it before a particular age or and even when we talk about this in our friend circle itself, maybe if we sit and talk, 4 out of 5 people wouldn't know. So what are these vaccines that they should take, and what is the right time period for these vaccines?
See, the most and relevant vaccination of the time is the HPV vaccine, which has a huge impact on the women's health. It's not just women's health, and when you talk about HPV vaccine, it's not for the girls alone, it's also for the boys. And HPV is basically a human papilloma virus infection, which is one of the main cause for the cervical cancer. That's the only thing which is being talked about also. HPV causing cervical. No, it's not that. It's about, HPV can cause different. They can cause genital warts. They can cause, even in boys, they can cause anal cancer, penile cancer, so many things. So generally when we talk about HPV also, it's always cervical cancer and HPV vaccine. It's not. And talking about HPV and cervical cancer in women, in girls, the ideal age, the best age to get a vaccination done is starting as early as 9 years. 9 to 14 is the best time to get a HPV vaccine done. but then most again awareness, lack of awareness. Even if you know, there you have a lot of questions behind. Even as a parent, even grandparents, they have, like I had a couple of my people discussing, and then I was talking about getting their kids. They're like, no, their parents or the grandparents are saying, no, why are you getting at this early age, young girls don't get all this things done. So that's not, it's proven, scientifically proven that this can prevent cervical cancer. And 9 to 14 years. It should be started as early, that early. That is 9 to 14 years, which actually meant before the first sexual intercourse. That's the whole idea of behind that, starting that.
If they have missed that window, then
so ideal age is 9 to 14, and in case if you're getting to know about it after 14, yes, it can still be taken, but then the dose changes. Like if you're taking between 9 to 14, it's always 2 doses. One dose has to be taken, and then the second dose. And then in case if it's after 14 days, then it's 3 doses. First dose, and then then followed by 2 months the second dose, and then after 6 months from the first dose is the third dose.
What about these German measles vaccines that you're supposed to? So if you are of reproductive, I'm just telling you what I've heard. If you're of reproductive age, you're supposed to take the vaccine before you plan on conceiving a baby.
Yes.
So what do you have to? Could you just
see? So that's what we generally are not. See, in Western countries, it's a part of their national, immunization schedule. We don't have it. That's why we don't take all these vaccines. So, like, say, right from
our vaccines end with
the first BCG and the kids neonatal vaccines, and we are done with all the vaccines. And then maybe whatever scratch or we go for a TT. That's the end of our vaccination. But that's not all. That's the influenza vaccine. All these kind of vaccines are there, which we actually have to take it to prevent ourselves from all this. That's what I said. This is a problem in India. Still, we are not aware of it, and people are not aware of it, are probably not going for it. But whereas in Western countries, in their immunization schedule, adult schedule, they have the HPV vaccine. So they take it on a regular basis, and it's mandatory for, just like how Pap smear. That was what I was going to. So just like how we talk about Pap, that's a part of their mandatory annual schedule that every woman has to get a Pap smear done, which is very, very. We are still in India. Most of them are not aware of it. Even if they know, we are not getting it done. I mean, I am okay. I don't have any symptoms, which is okay. And then why going and getting it done? But it's such simple. It takes hardly less than 2 minutes, and it has such a huge impact on your future life. It can detect. Let's jump into the Pap smear now. So when
so what are the benefits of Pap smear?
See, Pap smear is a simple screening test which can detect cervical cancer at the earliest stage, wherein there is a uterus, and the opening of the uterus is called the cervix. So there's a normal healthy lining for the cervix. The slightest change in the cervix can be detected by what we do basically in Pap smear is you make the patient lie down. There's a special spatula for it. You go, just touch it, scrape the swab test from it, and you send it for it. So they see the under the exam in the lab. When they check it, they can see the slightest changes which happens in the cervix. As early as, like they say, 10 years before the cervical cancer sets in. The mildest change, where if you detect it, that is the stage when that is not even a cancer, not even a pre-malignant state. So we get a lot of information with a simple 1-minute test. You can, if you diagnose some changes, and there are treatments available. There are that's what much before the cancer sets in. So which is very economical, not even very expensive, very simple to be done. Then what is stopping you from it?
I think it's more of the procrastination and priorities of people. Until recently, even dental checkup was seen as luxury. We could hardly see kids going in for dental checkups with regular dental checkups. Only if you have a toothache or you have a cavity, they would take you. But I think that trend is changing a lot. There are parents taking kids for regular dental checkups every year, every 2 years. So hopefully this would also...
Yeah, it's just like how you said about the dental, even the gynac checkups, not just the gynac checkup, but annual health checkups, which are very, very important. Like,
it's not the blood test alone.
No, it's not just, it's a cardiac health, like one of the most important, just like the any other cardiac health. If you take up a package or go for a regular checkup, it all covers basic everything, like right from the blood test, not just your sugar or the cholesterol, but then getting a cardiac evaluation done from your echo to TMT, and then getting a pap smear,
and even hospitals doesn't shed a lot of light into the importance of pap smear during a regular checkup.
Checkup, so pap smear and even ultrasound, getting an ultrasound of the abdomen is it's a very simple test, but you can actually detect a lot of things, like right from your reproductive health, your uterus, your ovaries, like smallest things like fibroid uterus or ovarian cyst, or it could be an ovarian tumor. All this can be picked up. See, the problem with when you now jumping to cancers again, ovarian cancer, when you talk ovarian, the problem with the ovarian cancer is by the time your symptom comes, in case of it's always advanced. The ovarian cancer, usually the ovarian tumor, when it gets bigger, and by the time you actually have some troublesome symptom, the stage is very higher up. So in that case, if you're getting it a regular ultrasound, regular checkup, including the ultrasound, you can detect these things as early, and you can treat it. It can actually bring a lot of change in your life. It can turn your life upside down. So which is very important. And even like ovarian cancer, when they usually have these kind of cancer, very non-specific symptoms, like some kind of non-specific distension or some back pain, very vague complaints which you tend to ignore. You don't really give so much of importance to these kind of non-specific symptoms. By the time you actually have some troublesome problem, like the tumor pushing the bladder, you're having so much of urinary problems, your constipation, or something pressure coming down, your severe back pain, then it's too late by the time you go. So why, when you can go for a regular checkup, get up all these things done, why not? Why not?
So I didn't actually plan on talking about this, but I think I should talk about it. As you know, 3 months back, a regular checkup like this is something that saved my life. So what I had a slight hair fall that I noticed. And just like always, we would, blame the water. It is hard water. The diet is not proper, etc., etc. But then, nonetheless, I thought of going for a test. And maybe because, as you said, this facility where arku illatondonnu alla. People tend to just ignore it. And we went for a blood test and saw that small elevation in hormones. Very casually went for a ultrasound scan. Ultrasound scan, what it costs, only 600 rupees. And it is done in every labs across the city. And that's when I was diagnosed with a borderline tumor. And one thing that, including you and all other doctors and friends of mine asked me is, what made you go for it? Maybe it is that instinct that, I should not procrastinate it, or I should just address it. So I think at every point our body gives us some signs.
And see, you got it, you went for it, you got it. I mean, you got out of it. But this may not be, most of them tend to ignore this kind of things, like, thinking, like, why? I mean, I'm okay. I mean, slightest, like you said, there was no specific symptom as such. Like, it was only vague. I thought, chalo, go get a thing done. But that's what, never, ever, ignore things. Even, like you said, it's just, what is there in ultrasound? Just, very minimal. But if at all, you can say what is there in ultrasound. But then the changes, if at all there's something, if you can pick up, and it just, it really matters. It's a massive,
And it really turns your life upside down. It makes you question all your choices. And
you will ultimately thank for being so thankful yourself.
Being present in the moment.
You're the presence of mind. You're going for it and getting it done. I mean,
So generally, the patients that you get, what age group patients do you generally, like most number of patients that comes to you, other than the pregnant women? What is the age category that comes to you? Because in skincare and in self-care and wellness, we have seen a general shift of it. Starting from, young adolescents and teenagers even coming and asking us for preventive health, or I don't want acne. Like mothers bringing daughters and saying, I've had acne during teenage, but I don't want her to get. So what is the category of patients that
gynec level? I get, obviously I get all range group, but again, yes, these days I'm getting a lot of the menopause related. That is like, again, very, very under-addressed or very, very, very relevant topic of the day. Get to see a lot of like me, my friends being so many going through it, and even others as also. There's so many who approach for menopausal related issues. It could be menopause hits in different ways. It's not just physical, not just the periods related. Lots and lots of mental, emotional things and gets involved. Just like PMS and how it affects the quality of life. The menopause actually affects the quality of life, not for everyone, but at least for many women, it actually affects in different ways. Now, right, starting from the periods irregularity, which I feel still people are somehow cope with it, but there are so many things much beyond that. The sleep disturbances, the hot flashes, and that's what the joint pains, bone pains, like that's
quality of life.
The quality of life really gets affected for so many, and the worst part is that they don't realize that's because of the menopause, or the partner or the people around fail to understand that what they're going through, even when and they are also not in a position to explain what is going on with them. And even if they explain, there is a lack of understanding about this.
Acceptance regarding the whole.
Acceptance is very, very poor actually with regard to this.
So, which is actually very good when you say you see a lot of menopausal women, because before it was like menopause I kanya my social life is done, or my sexual life is done. But I think now it has changed, and there is a big shift to an empowerment happening during that phase, wherein no, this is next phase of my life that is starting, just like after your teenage, your adulthood starts. So how can they very gracefully take it? What are the supplements they should have? Or how can they have very normal or
in a way I'm happy that I come across many women who are going through it. They're actually coming up and talking about it. Things have changed over a couple of years. Many are aware of it. They're coming and seeking treatment, HRTs, like replacement therapies. They are coming asking for it, or should we take it, or I'm going through this. Many are realizing these days that they're going through because thanks to Google to an extent, because a lot of Google search and the videos and all, it has really made an impact and awareness, and they are actually coming and asking for treatment regarding the HRTs and with the supplements again.
And how safe are HRTs? And what is the ideal time you should start on with an HRT?
See, menopause starts from the perimenopause. It depends. Like, it could be as early as say 45, 46 too, or it could be even earlier also in some women. But then generally it's starts from around 48 to 50 to 53. This is price. So the symptoms can start anytime by this time. Periods irregularity usually sets in by around 47, 48, and then it keeps changing, and the regular periods turns into once in 2 months, or no periods at all, to excessive bleeding, very heavy menstrual bleeding, and then finally over a couple of years it's gradually settles down and it stops. That's how it's regarding the periods. And what was the other question? So
HRT, when is the ideal time to start with?
So HRT we are taking mainly regarding the symptoms like same with like the periods, the other symptoms like hot flashes and all this sets in any point of time. So whenever and it's not just that, the emotional thing is like very, very important. They get angry, they get cry for no reason, and they beat up the kids or get angry on the husband partner for slightest of the things, which after a point they feel bad about it. And so all these kind of emotional and the physical things, when they realize, when you feel that you are going through this, immediately come and get a checkup done. And if that in such situation,
like an advanced stage of PMSing, like an advanced symptom of that they go through the whole.
The symptoms are somewhat similar.
Okay.
It's not totally the two different entities, but then symptoms mimics almost the same. But it could be, but the hot flashes are generally not. And symptoms. The emotional thing is more or less the same like the PMSing. But then severity could be very mild to very extremely severe also. So I would suggest in that case, who is going through this physical emotion, they should come and seek for either a different form of HRTs, like which there is no single fixed HRT, which fits for all. Like somebody comes to me and say, I'm on an HRT. It's not that I prescribe one HRT that is apt for We need to give and try. Some may suit for some may not suit for some.
Find out what
is your best. So I have multiple sittings. Start with one and see if it suits. If not, there are different preparations. There are oral tablets. There are transdermal patches. There are the different forms. There are vaginal creams. Different forms of HRTs.
And how long is it recommended? I mean, what is the time period that you...
It depends. It depends till when you're okay. Like there are so many factors. Like it depends on whether you're having a uterus. You have a uterus, or you got your uterus, because there are risks of HRT. HRTs cannot be liberally used also. Because HRTs containing the estrogen on a long-term effect can cause breast cancer, uterine cancers, things like that. So it has to be judiciously used, considering so many aspects. That's what I said. Nothing fits for all. It has to be. There are so many multiple factors which needs to be considered and decide what suits whom.
So they should meet a professional, get the help and guidance, figure out what works for them, and then have a regular follow-up in order to maintain what
the dose and the duration. Everything has to be just customized. So everything has to be discussed and followed up, and to see if it works for you. So something may not work for you. In that case, you need to switch to an alternate option. So this has to be
one or two lifestyle hack or changes that they can pick up that will really help them during their menopausal stage.
See, one is the exercise, weight bearing exercises like aerobics, and of course stress is also pumps are part of. So the meditation, yoga, these kind of, and weight bearing exercises mainly improves their body. Improves their bone health also, because after a point of time menopause sets in, the lack of estrogen keeps falling. Because the estrogen keeps falling, the bone health gets affected. The osteoporosis sets in, the bone becomes weak. So you need to have that bone health. To maintain that bone health, you need to take calcium supplements, and then weight bearing exercises like aerobics and all strengthening exercises. That really helps.
I think that's a very good discussion we have had about menopause, and I think my mom will be very happy because this is something that just started coming out, or the topic that everyone started speaking in just last 5 years. I can't even imagine what the women before that would have gone through. And how they would. I think
it was. It never existed for that age group. Now when we talk about, because we are aware of, now we know that women of today know that yes, I'm going through the menopause perimenopausal. Back then it is like
it's a part
of it.
Just like suppressing everything, they're supposed to suppress.
It's a general saying. What's new? Just like PMS, it's like periods. What is so much to talk about it?
So what about the seed cycle? This is something that everyone has been doing. I don't know how, my knowledge about it is very limited. So, how good is it? Is it preventive? Is it curative? What is your take on it?
Seed cycling is basically, it's very simple. It's basically adding some particular seeds, different phase of your cycle. So, there's nothing wrong in trying, because it's easily available. It's you just need to add those seeds during that particular cycle. Phase of it. So because basically about the PCOD and PCOS, because it's all about lifestyle and the hormonal changes. So it is said that this seeds can help in regulating the hormones. So if it is helping, just like how the lifestyle, the primary treatment being the lifestyle changes, adding some seeds, if it can help you, why not?
Another thing that is generally said, after you get your cycles, and when you're especially when you're ovulating, you tend to look your best. Right? And it's the hormones play. So, one question I got asked when I said we have somebody coming over is, what are the food that you can eat so that you get that hormone play in your body throughout?
Oh, which hormone are you talking about?
So, during ovulation,
Yeah.
why is that you glow or you tend to look good? Is it because of surplus of estrogen or whatever is happening during that time? Is there any routine that you would, or any food, reproductive health regarding
In
food?
general, reproductive health, it's always good to take a lot of antioxidants like, fruits and vegetables and all those fruits like berry fruits
Yeah.
and all. It's always good. And in general, not really in particular to the
Yeah.
ovulation, but then overall, ovarian health, it's always good to have antioxidants and fiber rich food like whole grains and,
Yeah.
all those. And then, generally healthy food. Yeah.
Okay, good. Now, one more thing, probably we'll wind up with this. We talk about stress a lot. And especially, we talk about it because, especially in this era, it's quite at its peak. Like, everyone is stressed about what they do, even if they're doing very well, are they excelling at it, and etc. Okay. Now, does this have an effect on people going through early menopause these days?
Early menopause is primarily family history. Like, it's a genetic. If your mom had a early menopause, say about 35, 38 years, and then there is a possibility, not necessarily, but there's always a possibility that you have a early menopause. Yes, of course, we are seeing a lot of people, women, attaining their early menopause these days. Definitely, we can relate it to the lifestyle. That's the only reason what we can, because lifestyle changes and the stress, of course. I think the amount of stress in women generally it's a great impact on the overall health, and the stress level has increased for all the working different kind of stress, like work related stuff, with the personal stuff, with the family stress. So of course, stress management is that's like I started saying in the beginning, stress has a major role in every system of your body. It's not just the reproductive health, but overall health of a woman,
of an individual. All right. I think we have covered a lot of topics. Vaccinations and pap smear being my most favorite topic, because I think if anybody who's watching us has not got the vaccinations done or has not got pap smear done, please do get it, because I think that will be the best birthday gift you can give to yourself, or just a gift that you can give for just being alive. All right, thank you so much for being with us, and thank you for a very informative session.
Thank you.
All right.
Thank you for having me.